Today topic of discussion is Rubella virus. Rubella virus belong to Tocaviridae family. It is a enveloped and single stranded RNA containing virus. Family Tocaviridae enveloped single stranded RNA containing virus. The shape is pleomorphic, roughly spherical in shape. This is the structure of rubella virus. The rubella virus causes rubella, disease name rubella. It also called as German measles. It is a mild exanthematous fever and skin involvement with maculopapular rashes and lymphoadenopathy. Rubella virus is also called as German measles. It is a mild exanthematous fever, then maculopapular rashes and lymphoadenopathy. Rubella usually trivial. It is usually trivial. That is not usually severe. But in case of pregnant women, the rubella virus can lead to congenital rubella symptoms in baby. So it is usually trivial, not usually severe. But in case of pregnant woman, it leads to congenital rubella syndrome in baby. The congenital rubella syndrome is made of triads. It consists of cataract, deafness and cardiac defect. So it consists of cataract, deafness and cardiac defect. So rubella Tocaviridae family, single stranded RNA virus, pleomorphic in nature, also called as German measles. It is usually trivial. In pregnant women, it will causes congenital rubella syndrome. It causes triads, cataract, deafness and cardiac defect. Patent tetanus arteries. So in cardiac defect, it causes like patent tetanus arteries. Cultivation and host range of rubella virus. The rubella virus can grow in many primary cell culture and also in continuous cell line like rabbit kidney, RK13 and Vero cell line. So rubella cell cultivation primarily cell culture and also continuous cell line like rabbit kidney, RK13 and Vero cell line. The cytopathic effect are produced only few cell lines like RK13. The cytopathic effect are produced only few cell lines RK13. Others, for the growth of deduction in other method, we use interference method. We are using interference method using EGO11 virus. Growth deduction interference using EGO11 virus. Coming to clinical features, the incubation period of rubella 2 to 3 weeks. The infection occur by inhalation. So incubation period 2 to 3 weeks. Infection occurred by inhalation. Firstly, they are generalized rashes on face, which then spread to the neck, trunk and extremities, sparing palmus and sole. So initially general rashes, then it spread neck, trunk and extremities, sparing palmus and sole. The rashes is discrete and disappear on third day. These rashes discrete and disappear on third days. And also non-tender enlargement of the posterior cervical gland. Non-tender enlargement of the posterior cervical gland. Rubella is most common in children. Sometimes it can produce the complication. Most common in children. Sometimes it producing complication include arthalgia and arthritis. Arthalgia and arthritis. This is most common in female with increasing age. Congenital rubella. In case of very early pregnancy, the infection with rubella virus can be abortion. In case of first trimester, there is up to 90% risk occurrence of congenital malformation in the baby. So congenital rubella, early pregnancy, it causes abortion. First trimester, up to 90% risk occur of congenital malformation in the baby. Second and third trimester, the infection leads to communication defect or developmental retardation. Second and third trimesters, the infection lead to communication defect or developmental retardation. This may not be apparent till the children grows older. Expanded rubella symptoms. Some cases expanded rubella symptoms is seen. Normally, it causes cataract, deafness and cardiac defect. Some other features, additional features include hepatosplenomegaly, then thrombocytopenic purpura, then myocarditis and bone lesion. Myocarditis. So additional features: hepatosplenomegaly, thermocytopenic purpura, myocarditis and bone lesion. These are the extra feature. The symptoms is known as expanded rubella symptom. Coming to laboratory diagnosis, important laboratory diagnosis when rubella suspected in pregnant female. Laboratory diagnosis in female, it is done by serological method or virus isolation. First serology ELISA is performed. Enzyme linked immunosorbent assay is performed. There is performed to detect IgG and IgM antibodies. If only IgM antibody present and IgG antibody is absent, it indicate IgM present, IgG antibody is absent, indicate only current acute infection. M present, IgM antibody present, IgG antibody absent, indicate only current acute infection. Whereas IgM minus, IgG present, IgG antibody present, IgM antibody minus. This one indicate past infection or vaccination status. Next, the screening test for a pregnant woman by torch panel. Torch panel. The torch panel stand for the infection. T stand for toxoplasmosis. O others. R for rubella. C for cytomegalovirus. H for herpes virus. So these are the screening test is performed for pregnant woman. Next, method of virus isolation. Isolation is performed from blood during early stage. So early stage blood test. Isolation is performed from blood during early stage and from the throat swab, rabbit kidney or virocell culture. So in throat swab, rabbit kidney or virocell culture used. In case of congenital rubella, laboratory diagnosis by serology include detection of IgM antibodies in newborn. The IgM antibodies is presented in newborn. It indicate intrauterine infection. IgM antibody presence indicate intrauterine infection. IgM antibody are tested because they does not cross placenta. Okay, IgG or trans placenta. This one not cross placenta. Then isolation is done by urine, throat swab, WBC, bone marrow and CSF. So isolation done by urine, throat swab, WBC, bone marrow and CSF. Next, epidemiology. Rubella, this one is worldwide distribution. About 80 to 90 percentage by human 15 years of age. 10 to 20 percentage of mothers are non-human. Therefore, they are vulnerable to develop rubella. So, they are vulnerable to develop rubella. Next, prophylaxis of rubella. Rubella infection provide long-lasting immunity. The prophylaxis mainly include vaccines. The vaccines is live attenuated vaccine with RA27/3 strain, which grown in human diploid cell culture to produce. So it grown human diploid cell culture, live attenuated vaccine with RA27/3 strain. Subcutaneous infection or it given in combination with measles, mumps as measles, mumps, rubella vaccines. So this is all about rubella vaccine. This one is the statement form. Thanks for watching.